Hello, my name is Nicole Stedino. I am your anatomy teacher. We will be checking out the muscular system today. We will be talking about the types of muscles, the functions of the muscles, their locations, and the important muscles to know about whenever you're practicing yoga. So yoga does more than burn calories and tone the muscles. It is a total mind-body workout that combines strengthening and stretching poses with deep breathing and meditation or relaxation. What we usually think of as working muscles is actually an organ made up of at least four different tissues: the muscle tissue, the connective tissue, the nerves, and the blood vessels. So the muscle tissue itself has the ability to contract and create movement. The connective tissue communicates that power of that contraction to whatever the muscle is connected to. It could be bones, it could be organs, or it could also even be the skin. Then the nerves tell the muscle when to fire, for how long, and at what intensity. And then the blood vessels provide that nourishment that allows the muscle tissue to be active. Let's take a closer look at the muscular system. The muscular system, the skeletal muscles are bundles of parallel muscle cells, blood vessels, and nerves wrapped with connective tissue, including fascia. So the fascia creates a network through and around muscles and other structures of your body. Muscles often work in antagonist pairs as the agonist muscles engage around the joint to support the action, and they are usually attached by the bone through a tissue called the tendon. There are three different types of muscles that we will be explaining here today. The skeletal muscles, we have the cardiac muscles, and we have the smooth muscles. The skeletal muscles are voluntarily contract and released to stabilize and mobilize the skeleton. The cardiac muscle, this is the heart tissue, which is also found in the tissues of the aorta, the pulmonary vein, and the superior vena cava. And then we have the smooth muscles found in all of our various tubes. Smooth muscles actually help to shape and also work with involuntary contraction. In order for us to be able to understand the muscles, we need to understand the names of them as well. Where does it come from? Or let's take a closer look at the muscles features, the names. When we talk about size, we usually address to vastus, huge. We could even say maximus, which is large, minimums, which is small, longus, which is long, brevis, which is short. When we talk about the shape, we could talk about deltoid, which is a triangular shape muscle. We talk about rhomboid, like a rhombus, with equal and parallel sides. The latissimus means wide, like the latissimus dorsi. The teres, which means around. Trapezius, like a trapezoid, it's usually a four-sided figure with two sides parallel. And when we talk about direction of fiber, we talk about rectus, which means straight. Transverse, which means across. Oblique, which means diagonal, and orbiculars, which means circulars. When we talk about the location, we usually address to pectoralis, which means the chest, the gluteus, which is buttocks, the brachii, which is the arm, the supra, which is above, the infra, which is below, the sub means beneath, and the lateralis, which is the lateral. Number of origins, we talk about bicep, which is a two-headed, tricep, three-headed, quadriceps, which is usually a four-headed, and the action. So we talk about abductor. When we talk about abductor, we mean move away from the midline. When we say adductor, move towards the midline. When we talk about flexor, move two bones closer. Extensor, move two bones farther. Levator, which is lift, and masseter, which is chew. Movement occurs when a muscle is stimulated. This stimulation causes the muscle to act in a what is often called muscle contraction. The term contraction connotes shortening in length. However, muscle actions sometimes involve the muscle lengthening even while creating any type of tension. We can best clarify this language by emphasizing that muscles' actions can cause, control, or prevent movement. They do so in three ways: by targeting concentric, isometric, and eccentric contractions. So your asana practice will work your muscles through their full range of motion, helping you to develop balance and strength and lessening your risk of injury. So what are the functions of the muscles? We talk about motion. The main function, which is the main function of the muscle, is motion. For example, in conjunction with the bones for walking, muscles may work alone. The diaphragm for breathing and the heart for circulating blood. Stabilizing, muscles help maintain body positions. Thermogenesis, muscles produce body heat. Support, muscles support soft tissues such as the abdominal wall and the pelvic floor. Guards entrance and exits. This is totally true. Muscles are also involved in swallowing, defecation, and urination. Sphincters muscles. Muscles and tendons. Tendons attach muscles to bones, transmitting the forces produced by the muscles moving joints. Tendons also have sensory nerves that communicate all of that information about muscle tension and joint position to the brain. And tendons and ligaments have limited capacity to stretch and do not contract. What are some of the characteristics of the muscle tissue? When we talk about muscle tissue, it could have irritability, contractibility, extendibility, and elasticity as well. So when we say irritability, muscles receive and respond to stimulation. When we talk about contractibility, allows the muscles to change the shape to become either shorter or thicker. Extendibility, living muscle cells can be stretched and extend longer and thinner. Elasticity, once the stretching force is removed, a living muscle cells retain its original shape. Types of muscles contraction: isometric, concentric, and eccentric. The isometric contraction, the muscle is activated, but instead of being allowed to lengthen, is shortened. It is held at a constant length. So let me give you an example of it would be, let's say, carrying an object in front of you. So let's say, imagine lifting a baby from a crib and holding it in your hands with your forearms level with the floor. To stably hold your arms in position, there must be an action. It is isometric contraction for your arm muscles that keeps your elbow joint bent and stabilized. Then we talk about concentric contractions, muscle activation that causes tension on your muscle as it shortens, and as it shortens, it generates enough force to move an object. Eccentric contraction is the motion of an active muscle while it is lengthening under load. Muscles. When concentric and eccentric muscle action creates movement, it receives support and cooperation from other muscles, thus giving muscles different roles. Let's take a look at these roles. We talk about prime movers. They're also called agonists. The prime movers are responsible for creating the movement of the body in any given range of motion. The agonist muscles generate the force that moves the bones. For example, the hamstrings would be the prime movers when flexing the knee joint to bring the heel back and up towards the hip. Antagonist. All agonist muscles are matched with antagonist muscles that must relax for the agonist to generate the intended movement of the body. So, referring to the previous example of the knee flexion, for the hamstrings to succeed in flexing the knee, the quadriceps must relax. Where the quadriceps, which are knee extensors and those that oppose the knee flexors, to contract while hamstrings were attempting to flex the knees, the opposing force would either stop, inhibit, or overwhelm the force of the hamstrings. Synergists, sometimes also called helpers or neutralizers. Synergist muscles complement the prime movers to help ensure that the intended muscles occur by preventing undesirable actions. So let's say in flexing the elbows, the biceps would be the prime movers, with the help of the brachioradius and the brachialis. Stabilizers, also called fixators. Stabilizers fix one part of a limb in place so that the movement can happen in distal positions, distal joints. So, for example, in strumming a guitar, the wrist extensors and flexors contract in isometric contraction to stabilize the wrist, to make sure that it holds in place, while the finger flexors and extensors work to strum the guitar. Stretching muscles. Static stretching. Most common technique used in Hatha Yoga. There are two categories of static stretching. We have the active static stretching, which involves contracting antagonist muscles to stretch a target muscles. So this would be like contracting the quadriceps, the iliopsoas, and the biceps. For in the forward bends, let's say like in Paschimottanasana, is a form of active static stretching of the hamstrings. Then we have passive static stretching, happens when we relax into a stretch using only the force of the body weight or externally applied weight to stretch muscles. Facilitated stretching. Yoga practitioners are use it to deepen their postures. Then we have dynamic stretching. Yoga practitioners use dynamic during vinyasa type practice, involves repetitive movements of the body into increasingly deeper stretchers. Locations of structures of the body. When we talk about medial, we say closer to the midline of the body. When we talk about lateral, we say away from the midline. Proximal talks about closer to the trunk or midline. Distal, away from the trunk or midline. Superior, above or towards the head. Inferior, below or away the head. Anterior, towards the back of the body. Ventral, on the front of the body. Dorsal, on the back of the body. Superficial, towards the skin, and deep inside the body. Medial would be closer to the midline. You guys can see it here in the middle. This would also be where the chakras would be aligned, in the midline. Lateral would be away from the midline, towards the left. Proximal would be closer to the trunk or the midline. Underneath, you guys can see where it says proximal. Distal, away from the trunk or midline. As you can see where it says proximal, if you go all the way down, you can see distal, away from the trunk or the midline. Inferior, we would be talking below or away from the head. You guys can see at the bottom where it says inferior. Superior, above or towards the head. Towards the front of the body would be anterior. Posterior, towards the back of the body. Ventral, on the front of the body. Dorsal, on the back of the body. On the right hand side, right there by the hand. You will be able to see dorsal and distal as well. Superficial, towards the skin, and deep inside the body. So this is part one of muscular system of anatomy. You were able to see the type of muscles, the functions of the muscles, as well as you would be able to see all of the different locations that are very important for us to know what works when it comes to yoga teaching or yoga, taking yoga classes as well. Thank you very much for your time. I hope to see you in the next class, which will be part 2 of the muscular system. I hope you guys have a good day.